Did you know that a simple toothache could actually become life-threatening? It sounds dramatic, but it's true. What starts as mild dental pain can turn into a dangerous infection that spreads beyond your mouth and affects vital organs. In today's video, we're going to talk about how an infected tooth can kill you, the warning signs you should never ignore, and what you must do before it's too late. Let's start with the basics. A tooth infection usually begins when bacteria enter the inner part of your tooth. This can happen because of untreated cavities, cracked teeth, gum disease, or trauma. Inside every tooth is a soft tissue called the pulp, which contains nerves and blood vessels. When bacteria reach this area, infection develops. Over time, this infection can form a pocket of pus called an abscess. At first, you might only notice pain. But this is not normal pain. It often becomes severe, throbbing, and constant. It may spread to your jaw, ear, or neck. You might feel sharp pain when chewing or even when lying down. Some people also experience extreme sensitivity to hot or cold foods that lingers long after the temperature stimulus is gone. Another major warning sign is swelling. If your gums, face, or jaw begin to swell, that's a red flag. Swelling means the infection is spreading beyond the tooth itself. You might also notice a bad taste in your mouth or even see pus draining from the infected area. Fever, fatigue, and swollen lymph nodes in your neck are signs that your body is actively fighting the infection. Now here's where things get serious. If the infection is left untreated, bacteria can move beyond the tooth and enter surrounding tissues. From there, they can enter the bloodstream. Once bacteria reach the bloodstream, the infection is no longer just a dental problem. It becomes a systemic problem affecting the entire body. One of the most dangerous complications is sepsis. Sepsis is an extreme and life-threatening reaction to infection. Instead of fighting the bacteria in a controlled way, your immune system goes into overdrive. This can cause organ failure, dangerously low blood pressure, and even death if not treated immediately. A tooth infection can also spread to the brain, causing a brain abscess. It can infect the inner lining of the heart, a condition known as endocarditis. In some cases, the infection spreads to deep tissues in the neck and floor of the mouth, causing a condition that can block the airway and make breathing difficult. Though these complications are rare today because of modern dentistry and antibiotics, they still happen when infections are ignored. You might wonder, how fast can this happen? In many cases, a tooth infection develops slowly over weeks or even months. However, once it spreads beyond the tooth, the situation can worsen quickly. In severe cases, life-threatening complications can develop within days. Certain people are at higher risk. Older adults, people with diabetes, those undergoing cancer treatment, or anyone with a weakened immune system are more vulnerable. For them, infections can spread faster and become more severe. The good news is that tooth infections are treatable. The key is early action. Dentists can prescribe antibiotics to control the infection. They may perform a root canal procedure to remove the infected pulp and save the tooth. In some cases, they may need to drain the abscess. If the tooth cannot be saved, extraction removes the source of infection entirely. Once the source is eliminated, the body can recover. But prevention is always better than treatment. Brushing twice a day, flossing daily, reducing sugary foods and drinks, and visiting your dentist regularly can dramatically lower your risk of infection. Small cavities are easy to treat. Ignored cavities can turn into dangerous abscesses. Regular checkups allow problems to be caught early before they become emergencies. The most important message of this video is simple. Never ignore persistent tooth pain. Pain is your body's warning system. Severe toothache, facial swelling, fever, difficulty swallowing, or trouble breathing are signs that you need urgent medical attention. A tooth infection may start small, but it should never be taken lightly. With proper care, it is completely manageable. Without treatment, in rare but serious cases, it can become life-threatening. If you are experiencing any of these symptoms, don't wait. Seek professional dental care immediately. Acting early can save your tooth, protect your health, and possibly even save your life. Take care of your teeth, and they will take care of you.